Does treatment-emergent central sleep apnea go away? If you or someone you know is dealing with sleep apnea and has started treatment, you might be wondering if a new issue called treatment-emergent central sleep apnea, TECSA, will go away on its own. Let's break down what TECSA is and what happens to it over time. TECSA is a type of sleep apnea that appears or persists while you're being treated for another type of sleep apnea called obstructive sleep apnea (OSA). This can happen when you're using treatments like continuous positive airway pressure, CPAP, devices, mandibular advancement devices, MAD, or even after surgeries. The good news is that in some cases, TECSA can resolve on its own with continued treatment. However, it's not a guarantee. For some people, TECSA might be a self-limiting problem, meaning it could go away spontaneously as the treatment continues. But for others, TECSA can persist. Studies have shown that the prevalence of TECSA varies, and it can occur in anywhere from 3.1% to 7.8% of patients using MAD therapy, for example. The reasons why TECSA might not go away include factors like ventilatory control instability, a low arousal threshold, and prolonged circulation time. These factors can make it harder for the body to adjust to the new breathing patterns during sleep. In terms of treatment, if TECSA continues, doctors might use additional methods to normalize your breathing during sleep. This could include adjusting your CPAP settings or using adaptive servoventilation, ASV, which provides dynamic pressure support to help stabilize your breathing. For people with severe complications, such as heart problems, treating both the underlying cause of the central sleep apnea and the abnormal breathing patterns at the same time is crucial. Treatments like CPAP and ASV have been shown to improve heart function in patients with heart failure and central sleep apnea. So, to answer your question, TECSA does not always go away on its own, but with the right treatment and adjustments, it is possible to manage and sometimes resolve it. It's important to work closely with your healthcare provider to monitor and adjust your treatment plan as needed.